It's tips time. Welcome to Training Intervention Program for Behavior Change. I am your psychologist and behavior specialist, Geraldine Garwood. Please remember to like, subscribe, and click the notification bell. Today I'm going to do part 2 of infancy development. This video is a follow-up to part 1 and also to a video done on attention deficit hyperactivity disorder, where I decided to look at developmental milestone of child development so that persons do not misdiagnose children when they are displaying typically developmental behaviors as having ADHD. So I'm going to be looking at infancy part 2, and then I will move on to looking at early childhood, middle to late childhood, and adolescence so that we can have a better understanding as parents and educators how to work with our children when they are displaying typically developmental behaviors as against when they have a diagnosis of attention deficit hyperactivity disorder. So, infancy development, what is involved in all of this? And so we move to part 2, where we're going to start off by looking at the brain as promised. So I decided that I'm going to spend a little bit more time on the brain so that we can understand what is going on as it relates to infancy. And please remember that infancy development is from 0 to age 2, 3. And then we will move on in our next video to look at early childhood development, which is age 3 to 6 years. Infancy development. So, infancy and the brain. And so, brain development is critical to all developmental stages that our children go through. And so, the brain plays a critical role in their development. And so, at birth, the brain is 25% adult weight. So the infant brain is 25% adult weight. And by 6 months, the weight of the brain is doubled to approximately half of the adult brain. And by 2 years, the brain is approximately 75% of adult weight. So by the child reach 2 years of age, their brain is approximately 75% of adult weight. And so there are some critical areas to the brain that I would like us to discuss. And these are 4 areas. The frontal lobes is involved in voluntary movements of infants. The parietal lobes is involved in processing information about body sensation. So senses, the parietal lobe is responsible for that. The occipital lobes is involved in vision, so they're seeing, and the temporal lobes is responsible in their hearing. It is involved in hearing. And so that is why in part 1 of infancy development, I talk about and emphasize that we should not allow the infant to hit their head, to fall and hit their head, because when that happens, they can actually develop traumatic brain injury, otherwise known as TBI. And so it is very important that we cushion infants on the bed. We ensure that they are in a playpen, in a cradle, or in a crib, so as to protect them as best as possible from not falling and experiencing any form of head injury. And so we look at their sleeping pattern of infants. So, newborns will generally sleep for 16 to 17 hours per day. However, some will sleep for up to 21 hours. And the state of arousal range from what we call quiet sleep to active sleep. So when you actually look at the infant, you can see that some of them are having a deep sleep we call quiet sleep. Some of them having active sleep, where sometimes we see them smiling in their sleep and they will move at times in their sleep, right? And so we're going to look at these types of sleeping patterns. So quiet sleep, what is that about? That is really inactivity in their sleeping pattern except for brief startles. So when they are frightened or they are startled about something. So there is no what we call rapid eye movement or REM. So when they're sleeping quietly, they're in a peaceful sleep, except if something startled them and they will jump out of their seat. And there is no rapid eye movement. But then we have the infant going through what we call active sleep, and that involves frequent body movements such as them twitching the legs, and you'll see facial expressions like they're smiling and the darting of eyes beneath closed lids during sleep. So you will see all that happening active sleep. And then by 3 months, the percentage of time spent in rapid eye movements falls to 40%. So by the time they reach 3 months, the rapid eye movements will fall to 40%, and about half of our infants sleep in rapid eye movements. And then we have shared sleep. And shared sleep is tend to promote breastfeeding and responding quickly to cries and detecting potential dangerous breathing of our infants. And so that is the three sleeping pattern that I thought is important for you to understand when you're observing your infant sleeping, whether between the age of birth to 2 years of age. And so we move on to a very critical part of their development, toilet training. And so it is important that infants get a lot of support during toilet training. And so by the toddler reach age 2, their body, they are able to control the muscles. And so parents are encouraged to apply what we as psychologists call the readiness principle to toilet training. And toilet training is generally a battleground um, because it is time consuming and a lot of parents do not have the patience for it. And so late toilet training can be difficult for children who end up going to daycare. So what we see happening now in today's era is that a number of the daycare will potty train the child for the parent. So that is a part of their service, toilet training. But we also encourage the parents to do toilet training so that it can be much easier for the child and they can have your support, because toilet training is very critical as it relates to their developmental process. And so during toilet training, or what we call potty training, you don't slap the child if the child have an accident, right? A number of parents slap the child if they wet themselves or if they defecate on themselves. That is also wrong, right? You need to just encourage a child. Don't let them feel embarrassed to do those kind of things, because it's a part of their developmental process. They all have to urinate, they all have to defecate, and so we don't want to embarrass them during that process. We don't want to slap them and let them feel that they are doing something wrong. So we ask that parents exercise patience during the toilet training period of infancy development. And so we move on to a critical stage for them, their motor development. And motor development is very, very important. It is key to infancy development. And so what is involved? And so we take some time to look at what is involved. From 0 to 1 month, the infant is prone to lift their head. And a number of parents can see that. 2 to 4 months, chest up, use arms for support, and they look so cute. 3 months, they are able to hold their chest. 3 to 6 months, they support some weights with legs so they can rise up a little. 7 to 8 months, or even a little earlier than that, they will crawl. 10 to 11 months, you have them cruising. You know, they are able to stand alone well by their 12 months. And even prior to 12 months, you have some of them standing alone by 10 to 11 months as well. They can stoop over, they can pick up something and recover to standing. They are usually walking by 12 to 14 months. And of course, we have some infants who walk earlier as early as 8 months old. And so by 13 to 18 months, they can pull a toy that is attached to a string. So you can give them a little string on a toy and they can pull it behind them. They can walk well. They learn to walk backwards. They can go up steps. Interestingly, they can go up the steps and come down the steps. They have knowledge of what we call depth perception. So normally when the infant is involved with any kind of staircase or going up the steps, parents are concerned that they will fall. But most of them have what we call depth perception and they are knowledgeable and they really do understand dangers. And so they will not necessarily fall, but you still need to monitor them, right? They are able to kick a ball forward at about 16 to 18 months, and they're able to throw ball overhand at about 18 to 24 months. They walk quickly, balance on feet in a squat position. So these are some of the things that the child will do, the infant will do during infancy development. And so parents, caregivers, if we are not seeing this happening with our infants, then we should get alert that something may be going on, that their developmental process may be slower and can be a cause of concern, and then we will seek the necessary help to understand what exactly is going on with the infant. And so we move now to another critical stage of infant development, language development, right? And I'm sure you're eager to know about language development. So for language development, there is vocalization. So between 1 to 2 months, again, the baby cry. That's a part of language, crying, cooing, babbling by 6 to 10 months, gestures by 8 to 10, 12 months. So it's like they're having conversations with you. You're talking to them, and it's like they are responding by cooing, babbling, and giving gestures. Also, they recognize language sounds as well. So parents, talk with your child. Talk with them. Talk with them, I said in part one, from within the womb. Talk with them at birth because they do recognize language sounds. They should be able to have their first word between 8 to 12 months, maybe a little earlier, and they can use about 10 words by 13 months and 45 to 50 words by 16 months. And then they understand about 50 words at about 13 months. And by 18 to 24 months, they should be able to have 2 words utterance. And we call that telegraphic speech. So they should have 2 words utterance and they should be able to be saying words in a sentence, right? And their sentence will not be long, but whatever they say, we should be able to grasp some kind of understanding. And so, parents, again, if you do not see this happening in your child's development, then that's another cause of concern. Please note, however, that some children are late bloomers, late starters, but I would recommend that you begin to keep keen watch on your child, your infant, if you're not seeing this happening during their developmental stage. And so we look at temperament. Very important. Because sometimes, children can be fussy. And so we need to understand that there are different temperament as children go through their developmental milestone. And so you have what we call the easy child. The easy child is a child that is more positive, cheerful, playful. That child will adapt easily to new situation. That child will quickly follow a rhythmic daily schedule, and that child would have regular sleep patterns, waking patterns, and becoming hungry. And that we see that in about 40% of infants. And then, of course, we have the difficult child. The difficult child is a child that displays negative moods, cries a lot, do not like to accept new experiences, slow to accept new experiences. When you leave them at daycare, they cry a lot. They don't want to stay. They are clingy. They have intense emotional responses. They cry and they're crying kind of draw our attention like what is going on, what is going on with my infant, you know. And so we 15% of infants tend to have this kind of temperament of being the difficult child. And then we have slow to warm up child. And of course, many of you probably are able to identify with these kind of temperament. You have the child who is slow to warm up. They take long. It is long for them to really readily go to persons, smile with somebody, talk with somebody, play, be responsive to another person. So they have what we call low activity levels. They are somewhat negative. They respond to situation in a mild way, and they are generally withdrawing from any form of new situations. And so when we see this happening with our infants, don't be alarmed. you know, it's just for you to understand that we have different temperamental styles, and infants do have different temperament. And so I just want to reiterate them again. You have the easy child, you have the difficult child, and you have the slow to warm up child. And it is important that our parents do understand that as it relates to child development. And then I want to give you some tips, parents, right? You, as parents, should be sensitive and flexible to the infant's signals and needs. So, whatever the infant so desire, you should be flexible to their needs. The signals that they send, you should be flexible. And critical to that, as parents, you may need to modify the environmental demands or expectation to fit the child's temperament and the child's needs, right? And that may sound like something difficult to do, but no, it's really not. What we're asking is that whatever environment the child is in, I know you may not have mastery or control over a child being in a daycare center, for argument's sake, but for daycare persons who are going to be watching this video, I would encourage them to create a context where when a parent leave the child, as you understand the child's temperament and what the child's developmental milestone involved during infancy, then you're able to create a context and environment for the child to be as comfortable as possible. And I know when it comes to daycare, the daycare may have different temperaments, children with varied temperaments, but they can set the the context in place. They can put things in place to make it more easier for the child. So parents, you need to understand that these are the behaviors that your child should be displaying during infancy, and that you really ought not to, what I would say, get disturbed if the child is doing these things. If the child is not doing these things, then that is a time where you need to be concerned, because it means that something is off in their developmental milestone. And so you need to be concerned about that. But when the child is doing all of this that was discussed, then you will have an understanding that the child is operating within their developmental milestone, and that is fine. That is fine. Nothing is wrong with them. They are to be doing those things, right? If they are not doing these things, then our antenna should be raised up. We should have some concern that they may be late in their developmental milestone. So I do hope that you have learned a lot on infancy part one and infancy part two. And stay tuned to the follow-up video where we'll move on to early childhood development. Again, When we subscribe, we build community. So please remember to like, subscribe, and click the notification bell.